Dr. Locks from Roundup Valley Veterinary Associates, and today I'd like to help you better understand dog spaying and neutering. So I have my licensed vet tech, Debbie, who's going to ask me some questions.
Dr. Locks, what is the difference between spaying and neutering?
The difference between spaying and neutering is that spaying is a term used for female dogs, where we remove the ovaries and the uterus, and neutering is a term used for male dogs, where we remove the testicles.
At what age should I spay or neuter my dog?
That is a very loaded question these days. There are people that sit on both sides of whether you should spay a female dog before or after her first heat cycle. I still think most female dogs should be spayed before their first heat cycle, which usually, if we spay them around 7.5 to 8 months of age, they will not have had a heat cycle yet. Some larger breeds of dogs, we do sometimes recommend waiting until after a first heat cycle to help with development of their hips and knees and long bones. So that's dependent on your dog breed and size, and you can have a more further in-depth discussion with your veterinarian. And for neutering male dogs, usually, again, unless they're large breed, probably somewhere around 9 to 10 months of age, unless they're having behavioral problems.
What are the health benefits of spaying and neutering my dog?
The health benefits of spaying your dog, you are 200 times less likely to get breast cancer if you never have a heat cycle. You cannot get ovarian or uterine cancer if you're spayed. And you also cannot get what's called a pyometra, which is an infection in your uterus, which can be an emergency, make your dog very ill, and they'll need emergency surgery. In terms of neutering, you will never get testicular cancer if you are neutered. Also, sometimes with aging, male dogs' prostates will become enlarged and affect their ability to be able to urinate, and they need to be neutered in order to fix that problem. And in both cases, it helps with population control.
Are there any reasons not to spay or neuter your dog?
If you are planning on breeding your dog, that would be a reason to not spay or neuter. But in general, I think by about a year to 2 years of age, depending on the situation, all animals should be spayed and neutered, in my opinion.
Are there any risks associated with spaying and neutering?
There are very low risks with spaying and neutering. They have to be under general anesthesia in order to have the surgery performed, so there's very low risks of an anesthetic complication. There's also very low risks of uncontrolled bleeding during either of the surgeries, and complications are very rare.
How should I prepare my dog for spaying or neutering procedures?
In order to prepare your dog, we would have you fast them, no food after 10 p.m. the night before. We do allow access to water overnight, and then please pick it up first thing in the morning. And then we have you drop them off in the morning between like 8:15 and 8:30 in the morning, where they're admitted for their procedure. They have it in the morning, and then they're discharged to you later the same day.
What should I expect on the day of surgery?
On the day of surgery, you should expect having a little bit of time to sign paperwork and get your dog admitted, and then time later in the day to go over discharge instructions before you take them home.
How long does a spaying and neutering procedure take?
The procedure itself, a spay, depending on the size of the dog, usually probably takes somewhere between 10 to 20 minutes. And for a dog neuter, that's usually much quicker, usually between 5 to 10 minutes.
What is the recovery process like for my dog?
For both recoveries, the spay is a little bit longer because in the spay surgery, we actually enter the abdominal cavity. The female dogs need to be quiet for 12 to 14 days. The male dogs need to be kept quiet for about 7 to 10 days. And in both cases, using some kind of an e-collar or surgical suit to keep them away from being able to lick or chew at the incision, as well as keeping them calm. And sometimes we do need medication to help us with that.
How can I care for my dog after surgery?
Caring for your dog after surgery, most important is just try to keep them quiet and to keep them away from their incision, and normal feeding and water consumption after the first day, and then just monitoring them.
Will spaying or neutering affect my dog's behavior?
Spaying and neutering does not usually change a dog's personality. It can sometimes help with aggression in male dogs or humping in male dogs, but that is not always a quick fix if your dog has a behavioral problem and there may need to be more intervention than just neutering them.
Can my dog still go into heat after being spayed?
A dog should not be able to go into heat after being spayed. Both their ovaries and uterus have been removed, and so there is none of the hormones in order for that to happen.
Can my dog get pregnant being spayed?
A dog would not be able to get pregnant after being spayed because there's no uterus to house the pregnancy and there's no ovaries for eggs to be ovulated to be fertilized.
Will spaying or neutering make my dog gain weight?
Spaying and neutering can change a dog's metabolism, and they often are more prone to weight gain after being spayed or neutered. So it is important to adjust their calorie intake and their activity depending on how their metabolism changes after the surgery.
Are there any long-term health issues I should monitor after spaying and neutering?
There should not be any long-term health issues after spaying or neutering your dog. Once they were recovered from that surgery, they should be good to go.
How much does spaying or neutering typically cost?
Spaying or neutering cost is very dependent on the size of your dog and how old your dog is and how many heat cycles your dog has had at the time that they're being spayed. So it would be best to just reach out to the office for an estimate that pertains to your dog.
What should I do if my dog has complications after surgery?
If your dog has complications after surgery, you should speak to your vet right away, and they should be able to help you deal with each complication as it comes along. Most complications after spay and neuter can be fixed with just a little bit of intervention. Thank you for these questions today on dog spaying and neutering. If you have more, please reach out to the office.